Good evening, everyone, and welcome to Diet and MS, a Neurologist Perspective. This webinar and telelearning series is brought to you by Can-Do Multiple Sclerosis and the National Multiple Sclerosis Society as part of our monthly series. My name is Brian Thompson, Programs Manager for Can-Do MS, and I will be your moderator this evening. As I mentioned, we're proud to do these webinars with the MS Society on the second Tuesday of each month, and it happens to fall on a very important evening with lots of ramifications. So we appreciate you taking some time to talk about another important issue with important ramifications, and that's your health and your diet. And taking time tonight to learn from a renowned neurologist on a very important topic. So thank you for being here this evening. For those of you that are new to Can-Do MS, we are a nonprofit based in Avon, Colorado, and for over 30 years we have been delivering educational programs on exercise, nutrition, and symptom management to inspire and motivate long-lasting change for those with MS and their families to help thrive. Please visit our website, which is www.mscando.org, to learn more about Can-Do MS's online and nationwide in-person programs. So at this point, it's my honor to introduce Dr. Bhargava, who is a board-certified neurologist and neuroimmunology fellow at Johns Hopkins Medical School in Baltimore. Prior to this, he served as a neurology resident at South Illinois University after earning his MD from Christian Medical College in Vellore, India. Dr. Bhargava has dedicated his career to gaining a greater understanding of multiple sclerosis and controlling the progression of the disease through clinical trials and publications for a wide variety of sources. Among his many honors, Dr. Bhargava received the prestigious Sylvia Laurie Physician Fellowship Award from the National MS Society and the Clinician Scientist Development Award from the American Academy of Neurology. So it's my honor to turn the floor over to Dr. Bhargava, who will lead us through his research on diet and MS. Dr. Bhargava.
Thank you, Brian. So I'm Bhargava, and I'm a neurologist. I treat MS patients at the Johns Hopkins University. And so today I'm going to be talking about diet and MS and, kind of giving you a perspective, talking about this from the perspective of someone who treats MS patients. And I'll go into why diet is important for patients with MS and what do we really know about diet. And why it's really important that we basically study it better and know and figure out what people with MS need to be doing about their diet. So just to begin with, why should we be studying the effects of diet in MS? So we know that MS, the prevalence of MS, not just in the U.S. but all around the world, actually continues to rise. And so does the prevalence of obesity. So the prevalence of obesity is rising as well in almost all countries around the world. And obesity is actually a risk factor for MS. So in two fairly well done studies, what has been shown is that if people are obese at the age of between 18 and 20, that's actually linked to an increased risk for MS later on in life. And another study that looked at children actually showed that if you have a higher body mass index between 7 to 13 years of age, especially in girls, that led to an increased risk for MS later on in life. And if you think about it, what really drives this risk for obesity is, again, diet. And so what I'm going to do is talk about, the different factors in the diet, and basically specific diets that have been suggested for MS, and we'll be discussing the evidence behind each of these. And so, moving on to the next slide, how do we think diet actually influences MS risk or prognosis? Like, why should what we eat make a difference to whether you get MS or what happens to your MS? And so, what we do know is that dietary factors can have direct effects on the immune system. So immune cells actually have receptors for certain factors in your diet, for example, vitamin D or certain kinds of fatty acids, can directly bind the immune cells and change their function. And also another really important mechanism by which diet can actually influence MS is altering your gut microbiota or your gut bacteria. And we'll talk a little bit more about gut bacteria, but there's more emerging evidence that the bacteria in the gut may be associated with not just MS, but other autoimmune disorders. And we also know that diet can actually change the composition of the gut bacteria. And so that might be a mechanism by which diet influences MS risk or how MS plays out. And the third possibility is that perhaps there are certain components in your diet that affect cells in your central nervous system, so your brain and spinal cord, and perhaps that provides some protection to cells in your brain and spinal cord from the disease. And so I'm just going to talk a little bit about the gut bacteria because it'll become more clear as we go on why it's so important to think about this. So inside all of us, there are trillions and trillions of bacteria in our intestines. And so it's about 100 trillion bacteria. And just to put that in perspective, 100 trillion bacteria is about 10 times the number of cells that you have in your whole body. So there are more bacteria in your gut than there are cells in your entire body. And the genetic material of these bacteria is 100 times the genetic material that you have in your body. So obviously, these bacteria play an important role. And what we now know is that these bacteria are normally in your gut, and they actually help to teach your immune system how to function, what belongs and what does not. And in various diseases, there can be alterations in the types of bacteria or the numbers of bacteria, and that can increase the risk for certain diseases. And what can change these bacteria? So dietary changes, when we use antibiotics, so these can change your gut bacteria, and perhaps there are other factors, and we're still learning about these factors. So it's important to keep this in mind as we move ahead. And so now what I'm going to do is talk about specific dietary factors that have been fairly well studied in the setting of MS, and then we'll talk about diets as such. And so probably the best or the most well-studied dietary factor in MS is vitamin D. And so all of you know vitamin D is also called the sunshine vitamin, and that's because when ultraviolet light hits our skin, then the precursor for vitamin D, which is called 7-dehydrocholesterol, is converted to vitamin D. And the vitamin D then needs to undergo more transformation to actually become the active form. Now, the first evidence that vitamin D was linked to MS risk came from a study back in 2006, where what they did was take people who had joined the military, and when people join the military, the serum is collected and banked. And so when they followed these people over time, they looked at people who developed MS, and they looked at similar people who didn't develop MS, and they went back and pulled the serum samples from when they had joined the military, and they looked at what was their vitamin D level at that time. And what they showed was that the higher your vitamin D level, the lower was your risk for developing MS. So if your vitamin D level was above 100, and so this is nanomoles, so it's a different unit compared to the nanograms per mil that you normally would hear in your reports. But basically, if it was higher than 100, which is about 40 nanograms per mil, you had an almost 60% reduction in your risk for MS compared to someone who was deficient for MS. And so that was really interesting. It was the first time someone had shown that vitamin D levels might increase MS risk. Now, it's fine to know that low vitamin D increases your risk for MS, but if you already have MS, your question is, well, how does vitamin D actually affect my MS disease activity? And so these studies, these are two studies, one done in children and the other in adults. And what this showed was that in children, for every 10 units increase in your vitamin D level, you had about a 30% reduction in the risk for a new relapse. And in adults, you had about a 30% reduction in the risk for active lesions, so that's lesions that are enhancing with gadolinium, and about a 20% reduction in new brain lesions if you had a vitamin D level that was 10 units higher. So these studies suggested that at least having a higher vitamin D level was associated with less MS disease activity. Now, so these studies that I just talked about, however, are what we call observational studies. And when we talk about treatment, we are looking for really strong evidence that a certain treatment works for a disease. And so we classify our levels of evidence from level 1 to the level 3. And level 1 is something called, is our best evidence. And that's, the best evidence we have that a certain treatment works is derived from randomized control trials. So what that means is that we enroll people with a disease. We then randomly assign them to two groups. One group would be treatment, and the other group will be placebo or control or some other treatment that's not the actual therapy that you're testing. And then you follow them over time and see whether that treatment works. And so that is the best way to figure out if something works. And the reason why it's so important to do something like this is to prevent what we call the chicken or the egg problem. And so let me illustrate that for you. So right now, so far, we think that low vitamin D leads to increased MS risk and worse outcome for people who already have MS. Now, what if people who have more severe MS just spend less time in the sun, and that's why they have low vitamin D? And so the low vitamin D itself has no bearing on MS risk or MS disease activity. Or, another example would be that people who have low vitamin D levels perhaps also have lower levels of sodium or zinc or chocolate intake, and it's actually more chocolate intake that actually improves MS and not more vitamin D. So you can see here that evidence from observational studies doesn't tell you whether a certain vitamin or supplement is actually going to help with a disease. And this is really important because we have been burned previously. So in previous studies, in observational studies, people found that if you ate more folic acid, those people who ate more folic acid had a lower risk for colon cancer. Or the people who had higher intake of vitamin A had less heart disease. And then they did a randomized trial where they actually gave people folic acid, and that actually led to more precancerous colon lesions. And the same for vitamin A, supplementing vitamin A actually led to more lung cancer and more heart disease death. And so these are, reminders to us that we have to test things properly in randomized trials before we start using them in our clinic. And so the good news is that we are now beginning to actually get results from trials of vitamin D. And so on this slide, I have results from two trials that are being done in Europe that were just presented at the MS meeting in London. And so the first trial was called the SOLAR trial, and what they did here was give people either 14,000 units of vitamin D or a placebo, so that's no vitamin D, for a year, and they followed 229 patients, out of which 80% completed the study, and they saw that there was a 31% reduction in new MRI lesions over the study period. So what that really is telling us is that, at least in this trial, which followed people for a year, the high-dose vitamin D led to a reduction in MRI disease activity. And in another trial from France, they used a slightly different dosing regimen where they gave 100,000 units 2 times a month for 2 years in 129 patients. And what they found in this study was that there was about a 20% reduction in relapse rate in the overall population. But if you just took people who actually completed the study, and that was one of the drawbacks of this study, was that many people dropped out of this study. But in those people who completed it, there was a significant reduction, almost 60% decrease in relapses, and there was also a reduction in new MRI lesions. Now, we also have a randomized trial of vitamin D ongoing here in the U.S. At 17 different sites. And in this trial, we're testing a high dose of vitamin D, which is 5,000 units a day, versus a low dose, which is 600 units per day, in addition to glutathione acetate as a disease-modifying therapy. In the previous two trials, vitamin D was tested along with interferon. So that's the difference between this trial and those trials. And so the VIDANS trial here in the U.S. is still ongoing, and hopefully we will have results in about a year from this trial. Now, another observation that we've made in the clinic when we treat people with MS, we give them, who have low vitamin D levels, you give them vitamin D to bring their vitamin D levels up. What we found was that sometimes people take the vitamin D for 6 months and their levels don't change. And, you ask them, are you taking your vitamin D? They say, yes, I haven't missed a single dose. And so we wanted to ask, do MS patients handle vitamin D the same way as healthy people? And so in this study, we took 27 people with MS and 30 healthy people and gave them 5,000 units of vitamin D a day for 3 months. And what we found was that the MS patients had a lower increase in their vitamin D levels compared to the healthy people. And so what this was telling us is that perhaps MS patients actually handle their vitamin D differently. And from a practical standpoint, what this might mean is that if your neurologist prescribes vitamin D, you may need to have your vitamin D levels monitored over time to make sure that you're having an adequate increase in your vitamin D levels. Now, I talked about the gut bacteria and the gut bacteria being important. So in this study where we were looking at the response of vitamin D levels in MS patients and healthy controls, we also looked at the gut bacteria. And what we found was that vitamin D treatment actually changes bacteria in the gut in MS patients. And I'm not going to go into what precisely each of these bacteria do, because we really are still beginning to understand that, and we still don't know, which are the good bacteria for MS, what are bad bacteria for MS. But what we can see here is that vitamin D actually changed your gut bacteria, and that might be a mechanism by which the vitamin D is actually helping people with MS. So I'm going to summarize what we know about vitamin D. So we know that vitamin D deficiency leads to an increased risk for MS, and if people already have MS, it is associated with worse disease activity. We still don't know what the correct or the right dose of vitamin D is, because all the trials that I showed you are all using different dosing regimens. And so it's still unclear, whether you should take 2,000 units a day, 5,000 units a day, 14,000 units a day. But hopefully, once all these trials are done, we will be able to figure out a level that we need to attain to be able to minimize disease activity or to optimize the effect of vitamin D. And so, at least so far, the results that we've gotten from trials suggest that high-dose vitamin D actually reduces MRI disease activity in patients with MS. And we're also finding that MS patients perhaps may not handle vitamin D the same as healthy controls. So perhaps over time it would be important to monitor how vitamin D levels are changing in patients with MS. So I'm going to move on from vitamin D. We're going to talk about polyunsaturated fatty acids. And so this is another dietary factor that has been studied in MS. And so what are polyunsaturated fatty acids? So polyunsaturated fatty acids, or PUFAs, are basically fatty acids that have two or more double bonds in their chemical structure. And depending on where these double bonds are, they can be either omega-3 polyunsaturated fatty acids or omega-6. And the reason why people talk about them so much, and that you're hearing about PUFAs so much, is that they're involved in the production of several inflammatory molecules. And some of these inflammatory molecules are anti-inflammatory, while some are pro-inflammatory. And also, several immune cells actually have receptors for these polyunsaturated fatty acids. So that is why people think that the polyunsaturated fatty acids may be important in autoimmune diseases like MS. And polyunsaturated fatty acids can be derived from both plant sources, so several oils like soy oil or walnut oil and other nut oils have PUFAs in them, and animal sources, really fish, have a high content of omega-3 polyunsaturated fatty acids. And so the first question is, are polyunsaturated fatty acids even linked to MS in any way? So this study was presented at the European MS meeting last year in Barcelona. And so this included women in the Nurses' Health Study and the Nurses' Health Study 2, which is basically about 150,000 women. And so they obtained data on diet from a standardized questionnaire. And when they analyzed this data, they found that a higher intake of polyunsaturated fatty acids when people entered the study was associated with a lower risk for MS. And specifically, when they looked specifically at which polyunsaturated fatty acids, they found that linoleic acid and linolenic acid intake appeared to be associated with the lower MS risk of all the polyunsaturated fatty acids. Now, this other study from Australia enrolled about 267 patients with MS and 517 people who didn't have MS, and then looked at their diet. And what they found was that if you had a higher intake of the omega-3 polyunsaturated fatty acids, that led to a 40% reduction in your risk for MS. And if most of those omega-3s came from fish, that lowered your risk even further. So at least, there seems to be some evidence that polyunsaturated fatty acid intake might be linked to, or a higher polyunsaturated fatty acid intake might be linked to a lower risk for developing MS. Now, the next question is, would supplementing polyunsaturated fatty acids actually lead to less MS disease activity? And so there have not been many trials looking at this, and so the two studies that are out there are not particularly well done, but we'll go over them. So the first was a study from 2005 where they supplemented a low-fat diet with either omega-3 polyunsaturated fatty acids, so fish oil, or olive oil. And so this study only had 31 patients, and they did not have a really good control arm. So they compared the quality of life and relapse rate to what had been a person's rate before this intervention. And so that's not really a good method of doing it. And so they did see some evidence that there might be a reduction in, or an improvement in quality of life scores and a reduction in the relapse rate. However, another study called the OFAMS trial basically treated people with two polyunsaturated fatty acids, so epoprostanoic acid and docosahexaenoic acid. And these are actually the omega-3 PUFAs that are really rich in fish. So that's the reason they chose these two PUFAs. And they gave this in addition to interferon as a disease-modifying therapy in 46 people in one arm, in the treatment arm, and then in the other arm of 46 people, they got a placebo. And when they looked at over 2 years, they saw no difference in MRI or clinical disease parameters with the polyunsaturated fatty acid supplementation. So looking at the data that we have on polyunsaturated fatty acids, there does seem to be some evidence that low polyunsaturated fatty acid intake, especially omega-3s, might be linked to an increased risk for developing MS. And we know from data in the lab that polyunsaturated fatty acids can actually act on immune cells and have immunosuppressive effects. However, so far, our trials of actually supplementing polyunsaturated fatty acids have been conflicting. And so we need larger studies and better studies to actually clarify whether actually increasing your intake of polyunsaturated fatty acids would lead to or would be beneficial for people with MS. All right, so I'm going to move on to salt and salt intake and whether that has an effect on MS. And so, the whole idea of salt being associated with MS came out about 3 years ago when it was shown that if you took immune cells, from our blood, and one of the immune cells that are really important in MS are the T lymphocytes, and specifically T lymphocytes that produce pro-inflammatory molecules or cytokines. And one of these is interleukin-17. And so interleukin-17 producing T cells are thought to be particularly bad in people with MS. And so when people took these immune cells out of the body and put them in a media or a solution that had no salt in it, they had very little production of this interleukin-17. However, if they added salt, they saw that there was a lot of production of this interleukin-17. So salt promoted these inflammatory cells. Now, what they did next was to take animals, so these are mice, and we have mouse models that mimic some of the features of MS. And so if you take these mice, induce the disease in them, and then if you fed them a high-fat diet, they had a more severe disease course compared to mice that had a normal diet. So at least in mice, in this mouse model, high-salt diet seems to worsen disease activity. So really the next question is, does high salt actually make a difference to MS disease activity? So this was a study, and this is a retrospective study, so this is people looking back at the data they have, trying to figure out whether salt intake influences MS disease activity. And so one of the ways in which we can figure out how much salt someone is eating is to actually look at how much sodium is in their urine. And so what they did in the study was figure out how much salt people are eating by taking urine samples. And what they showed was that the higher your sodium intake, so this is less than 2 to 4.8 or more than 4.8, what they showed was that the higher your salt intake or sodium intake, the higher your risk for having relapses while they were following these people. And also, a higher salt intake was associated with a higher risk for developing new lesions on the MRI. So at least this one study seemed to suggest that high salt intake might increase MS disease activity. However, more recently, this was data that was presented at the American Academy of Neurology meeting earlier this year, and this was from a large trial of one of the interferon medications. And what they did was they looked at salt intake in these people who were in this trial, and again, using urine samples. And what they found in this study was that, even with increasing salt intake, there did not seem to be an increase in the number of MRI lesions or a change in the amount of lesions you had overall on your brain MRI or in your brain volume. So in this trial, there was no relationship between salt intake and MS disease activity. So just summarizing what we know about salt, we know that high salt concentrations actually promote inflammatory T cells. High salt diet makes mouse model of MS worse. And in one retrospective study, there seemed to be some increased risk for relapses in people who were eating more salt. However, in this large benefit trial of beta-seron, salt intake had no relationship to clinical or MRI disease activity. So at this point, the relationship between salt and intake and MS disease activity is uncertain, and we need more studies to clarify that. Now, despite that, I would personally recommend eating a low-salt diet just because of all the other benefits that it has, especially in terms of cardiovascular. So moving on from these dietary factors, I want to talk a little bit now just about all the different diets that are out there and all of you have heard of. And when you Google, you see all these diets that claim to cure your MS. And so we're going to talk a little bit about that. But the first thing I'm going to talk about is first I'm going to actually, again, come back to gut bacteria. And so if you take a bunch of people and look at their gut bacteria, you can basically divide them into two groups. People who have more of a class of bacteria called Bacteroidetes, or people who have more of a class of bacteria called Firmicutes. And what's really interesting is that these two subtypes of people really depend on what type of gut bacteria predominates depends really strongly on what kind of diet you eat. And so your long-term diet is very closely linked to what your gut bacteria are going to look like. But what's even more amazing than that is that diet changes can actually very rapidly change your gut bacteria. So in this study, people were switched over from their regular diet to either a plant-based diet or an animal-based diet. And what happens in an animal-based diet, and let me just show you that, is that your fiber intake goes way down compared to a normal diet. And within a few days of changing their diet, down here is actually the diversity of your gut bacteria. So within a few days of changing your diet, there is already a major shift in the contents or the bacteria in your gut. And so it's really important to realize that diet has a profound effect on these gut bacteria, which we are learning have many functions in the body, including educating and controlling the immune system. So coming back to diets, diets that have been proposed for MS. So this is just a small selection of the diets. So this is probably just the diets that I get asked about most often. There are more diets than this, but we're going to talk about these, and then and then I'll talk a little bit about some other aspects of diet. So these are diets that have been proposed, or if you Google diet and MS, these are diets that will come up. But the diets that have good evidence for an effect in MS are none of these. So no diet has good evidence for an effect in MS patients. All right, so let's talk about each of these diets individually and just what they entail and what are some of the caveats to think about when you think about following any of these diets. So the paleo diet or Paleolithic diet is basically attempting to eat a diet that is similar to what people perhaps ate in the pre-agricultural revolution. So when people were not farmers, they were hunters and gatherers, what people ate at that time. And so what this involves is elimination of all processed foods. One of the features of this diet is that animal protein actually makes up a very large proportion of daily caloric intake, almost 30 to 35%. There's a high fiber diet, which is so the fiber intake is almost 45 to 100 grams per day, and this is not based from cereal. And there's a low ratio of saturated fat to polyunsaturated fat. So paleo diet is actually very rich in polyunsaturated fat. So I'm just going to share 3 recommendations from, and this is from basically the world's protocol that includes the paleo diet as part of it. And so what they recommend is consuming 3 servings per day of each of these, which are green leafy vegetables, sulfur-rich vegetables, and intensely colored fruits or vegetables. They also recommend consuming 2 tablespoons of omega-3 oils, at least 4 ounces or more each of animal protein and plant protein. You can consume non-lactose containing milk, and no more than 2 servings per week of either gluten-free grains or starchy foods. So, dairy and gluten-containing grains are basically completely cut out, as are all processed foods. So, studies on the paleo diet. So, there's only been one small study of 10 patients with the paleo diet, of whom only 6 completed that study. And this did not study the diet in isolation, but actually, this included the whole protocol, which also coupled the diet with exercise and other interventions. And so in this study, in the people who completed the study, there seemed to be some reduction in fatigue scores. So the important thing to remember, though, with the paleo diet is because of what it excludes, it can actually result in deficiencies in certain vitamins. So folic acid, thiamine, and vitamin B6, because those are rich in cereals, and also calcium and vitamin D because you're cutting out the dairy. And so it's important to remember that, and those would need to be supplemented if you were on a paleo diet. Now, the paleo diet is going to be studied further, and hopefully in the future we will have more information on what kind of an effect the paleo diet would have on MS disease activity. So I'm going to move on to the McDougall diet. And so this diet is a low-fat, high-carbohydrate, moderate sodium vegan diet. And so really that's the main characteristic of this diet, is that it's vegan. So there are no animal-derived foods at all allowed. So no dairy, eggs, meat, poultry, fish, they're all excluded. And oils are not allowed. So because it's a low-fat diet. And they also encourage low sodium intake. People are encouraged to eat, wheat, flour, corn, rice, oats, barley, and then potatoes, sweet potatoes, beans, peas, and lentils, and any amount of fresh fruits, non-starchy greens, or color vegetables are allowed. And this diet has been studied in MS. So there's one study which was actually published very recently. It was a trial of 61 patients. So half were on the diet, half were actually weight-lifted to be on the diet. And about 80% of people actually completed this study in the diet group. So people who went on this diet did notice a reduction in their weight. They had improvements in their lipid profiles and some improvement in their fatigue scores, but there was no change in MRI or disease parameters. And now, what's a caveat of this diet is that people in this study actually underwent training for how to follow this diet in a residential program, and that's really not a very practical model. So the McDougall diet can result also in deficiencies in iron, vitamin B12, vitamin D, and calcium because you're cutting out all animal derived foods. So again, so there might be some evidence that there are some beneficial effects from this diet, but it again needs more study. All right, so I'm going to talk about the Mediterranean diet next. And so this is a diet that's been extensively studied for its beneficial effects on cardiac health and cancer. And so essentially in both those scenarios, it is beneficial. And what the Mediterranean diet advocates is a high intake of whole grains, vegetables, fruits, legumes, olive oil, and fish, and a low intake of saturated fat, red meat, poultry, and dairy products, and also a regular but moderate intake of mainly red wine. And this picture actually shows you, kind of the pyramid for the Mediterranean diet. And so basically, you have, you eat more whole grains, fruits, vegetables, and legumes. You eat less dairy, and fats, and very little of basically eggs, poultry. You're probably eating red meat only a few times a month, if at all. So that basically is the Mediterranean diet. The Mediterranean diet specifically has not been studied in MS. However, very often I will advocate this to my patients just because it has beneficial effects in other diseases, especially other diseases that become more common with age. Now, the Swank diet is a diet that was advocated by Roy Swank, who was a neurologist in Oregon. And basically, it is a low-fat diet. So you eat low amount of saturated fats, less than 15 grams a day, and you eat unsaturated fats, less than 20 to 50 grams per day. And basically, you do this by eating no processed foods that contain saturated fats, and you ensure that any dairy products that you're eating have less than 1% fat. They basically recommend, again, whole grain cereals and pastas, and every day people are advised to eat 2 cups each of fruits and vegetables. No red meat for the first year, after which they can eat 3 ounces a week. And they allow white fish and shellfish in any amount, and skin trimmed poultry meat is also permissible. And again, they advocate a cod liver oil and multivitamin supplements. And so that's omega-3s and then multivitamins. So, so Roy Swank studied the Swank diet, and so he basically advocated this to all his patients, and he divided his patients out into people who followed his diet and then people who didn't follow his diet. So he followed 144 patients over 34 years, and what he found was that people who were on the low-fat diet had less deterioration and a lower death rate compared to those on a high-fat diet. However, it's really important to understand that this study was done before disease-modifying therapies were available. There were not appropriate controls. So this is people selecting for themselves what diet they wanted to go on, and there might be other factors that influence, the outcome besides the diet that we're missing here. So again, this is a diet that would probably warrant more study. Now, the other diet that I hear a lot of patients ask about is a gluten-free diet. And so what is gluten? Gluten is a protein that's made up of gliadin and glutenin, and it's found along with starch in wheat, rye, and barley. And it's basically the major component of the proteins that are found in wheat. And gluten sensitivity is a feature of celiac disease, which is a different disease from MS. It's also an autoimmune disease. And a gluten-free diet is actually a treatment for celiac disease where you're actually sensitive to gluten. And for people who actually have gluten sensitivity, it's also important for them to remember that wheat-free is not the same as gluten-free. However, there really is no evidence that gluten-free diet is beneficial in MS patients who do not have gluten sensitivity. So if people have gluten sensitivity, then a gluten-free diet would be beneficial. However, without that, there probably isn't definite evidence that it's beneficial. Now, it's also important to remember, though, that when people go on a gluten-free diet, you usually end up losing a significant amount of weight because you're cutting out these gluten-containing grains, which are one of your major sources of caloric intake, and that can sometimes make people feel better. but we don't really have any definite evidence that gluten-free diet helps people with MS. All right, so if you really distill down what's really common to all these diets that I've spoken about so far, you can really put it in these 7 words that Michael Pollan, who's a famous a writer about nutrition, said. So eat food, mostly plants, and not too much. So if you break this down, really, we're saying eat food, and that means real food, not processed junk, and mostly plants. So our diet should basically be based on plants, so that's fruits and vegetables. That needs to be the staple of your diet, and not too much. So, controlling how much we eat. And I'm going to talk a little bit more about this part, the not too much part, because there's some really interesting data that is emerging about the fact that the number of calories we eat might actually be really important. And so, in mouse models of other neurological diseases, but especially dementia, there's actually been improvement with restricting the amount of calories those mice eat. And that's actually associated with less inflammation in the brain. And in mouse models of MS, restricting calories before you induce the disease actually leads to a lower risk for developing the mouse model of MS and less severe disease in the mice that do get sick. And a recent study looked at a fasting mimicking diet. So the previous studies looked at giving mice less calories, continuously. However, this study looked at a diet that mimics fasting. So, for example, people can fast for a day or 2 at a time. And so what they did here in this mouse model is they made the mice eat less for 2 or 3 days at a time, and then they would eat normally for 4 days. And what they found was that if they did cycles of this fasting mimicking diet, the mice that did that had less severe disease compared to the mice that had the normal diet. And so again here, mice that have a normal diet are sicker. Mice that are on this fasting mimicking diet are actually less sick. And if we, in mice, when you look at their spinal cord, you can see that mice that have the fasting mimicking diet have less damage and have less loss of myelin in their spinal cord. So that's really interesting. They look at, so what exactly is happening to the immune system when you fast or restrict calories in these mice. And what they found was that the fasting mimicking diet actually increases the number of regulatory T cells. And these are immune cells that suppress the other inflammatory or the bad T cells. So they basically suppress the T cells that are causing inflammation. And they found that these inflammatory T cells were actually dying off with the fasting mimicking diet. And so that's really interesting to know that fasting can actually modulate the immune system in such a way. And they then looked to see, can caloric restriction actually promote repair? So in a different mouse model, so this is a mouse model where the mice are fed a toxin called cuprizone. And what this toxin does is that it kills oligodendrocytes, which are cells that make the myelin. And if you give this to mice, the myelin goes away, and this is a stain of a part of the brain looking for the myelin. And normally it should look like this. It should be blue. And here, after you give them this toxin, all the myelin is gone. And now if you put mice on the fasting diet, so normally the myelin will recover gradually. But what they found was that if you put mice on a fasting diet, they actually recover better than mice that are not on a fasting diet. And that's really interesting. And so part of the recovery in this model happens through the immune cells that are in the brain, called the microglia. And so we think that the caloric restriction or the fasting might be affecting those immune cells and helping with repair in this model. So we need to study this in people and see what does fasting actually do in patients with MS. And so at Johns Hopkins, we're currently conducting a trial of fasting. And so where we have 3 groups of people, one group actually eats a normal amount of calories for 5 days of the week, and then 2 days of the week, people eat only 25% of their caloric requirements. So that is the fasting like you saw in that mouse model. And another group of people actually eat, also reduce their calories, but that is spread evenly over each day, because we're trying to see, is this effect actually from fasting, or is it just from loss of weight that happens from cutting down calories? And then a third group is actually eating a normal diet every day. And at the end of this study period, we follow them to see, are people actually able to continue to adhere to this kind of a strict diet? And also we look to see, how does this change their immune system? How does it change metabolites in the blood? And how does it change their gut bacteria? And so this is ongoing, and hopefully in the near future we will have results from these studies. So just summarizing diets in MS, so many different diets have been proposed for MS, but there's no clear evidence for a benefit from any of these trials in MS. So we need more rigorous studies that actually measure how well people adhere to these diets, and how that affects disease activity and quality of life in people going on different diets. And what's, I think, really interesting is that change in the amount of calories you eat or fasting may lead to a reduction in inflammation and perhaps even promote repair, at least in mouse models. And so trials of this strategy, so not just a specific diet, but actually fasting or cutting down calories, are actually ongoing, and that will provide us with more information on the feasibility and efficacy of this intervention. And so just, summing up in future directions for MS, for diet in MS, then we really do need to study diet and the various supplements in MS. And currently we have insufficient high-quality data to recommend specific diets or really any supplements except for perhaps vitamin D for treatment or prevention of MS. And though these studies are really challenging to do, they're necessary, especially because of what we know with our prior experience with other supplements in the past. All right, so I'm going to stop there, and then I'll take questions after this.
Excellent. Thank you, Dr. Bhargava, and so much great information, and we got great questions coming in. So we have a few minutes, and we'll try to get to as many as we can, and we'll talk afterwards about if we don't get to your question, there's still opportunities to get your questions answered through Can Do MS. So probably the most popular question we received was about vitamin D, which we started off with this evening. Could you just go into some more specifics about what's the target amount for of vitamin D that we should be shooting for? Is too much or too little? Is that dangerous? And is there a specific type of vitamin D that is recommended?
Yeah, so let's just go into that a little bit. So really, as with anything else, too much vitamin D can be dangerous because too much vitamin D can raise your serum calcium levels, and then that can have harmful effects. So far we don't know yet what is the optimal level that you need to get to. So looking at the previous studies where they looked at, what level is associated with decreased disease activity, in those studies, really people's levels only went up to about, 50 or 60 nanograms per mil, because that's what people had, the levels people had without having vitamin D supplementation. And so right now, what I normally recommend to patients is to keep their vitamin D levels between around 50 and 60 nanograms per mil. And so I will normally put people on about 4,000 to 5,000 units a day, and then check their vitamin D levels every 6 months or so to see if they're getting up around that level. And the target levels will become more clear when we get more information from these randomized trials where we're seeing improvements in MRI disease activity, and we hopefully will find out what are the levels at which we're really seeing changes in disease activity. So that's about the levels. And so again, one of the problems with all the information that we have out there and just the trials with vitamin D is that everyone has used different doses. So really so far doses even up to 10,000 or 14,000 units a day have been safe. But normally in clinical practice we use anywhere between 2,000 and 5,000 units a day for people who are beginning in a normal range, while people are really low, so less than 15 nanograms per mil. We'll actually dose like a 50,000 units once a week. And for the most part, we recommend taking vitamin D3, and that's available over the counter. And for most people, that is fine as long as their levels of vitamin D in their blood, which is the 25-hydroxy vitamin D, as long as that's going up, then that's fine. However, sometimes there are people in whom, if those levels are not changing, then they can try, a different formulation of vitamins like vitamin D2.
Great. And another question we got on the vitamin D studies that you presented. He was curious, how do we know that the results that you described were from the vitamin D and not from the interferon or from another DMT?
Yeah. So basically, all people are on the same DMT, the interferon or the glutathione or acetate, and so then in addition to that, they get vitamin D or no vitamin D or high-dose vitamin D and low-dose vitamin D. So basically, when we're saying that there's a reduction in disease activity, it is the reduction beyond the reduction of just from just interferon or disease-modifying therapy.
Thank you. Moving on to the next subject we talked about, which was salt. We got a few questions on does the different type of salts affect the results that you saw? So iodized or kosher or sea salt or Himalayan salt. Does the type of salt, does that change anything at all, or anything particular kind that you would recommend?
So well, not really. So we basically we're looking at sodium chloride. So it's iodized or non-iodized. Probably doesn't make a difference. So the bottom line really is that we still don't know that the salt intake actually affects MS disease activity. We do know that salt intake is associated with high blood pressure, cardiac problems, things like that. So I still do recommend a low sodium intake to patients. And it's also important to remember that sodium is not just in salt, but it's also in food.
Right.
Like in food that's preserved or baked and stuff like that. So it's important to consider that when you're looking at your salt intake.
Excellent. And during that part of the presentation, you also mentioned that that chocolate may be helpful, and we had a couple questions about that.
Sorry. So that was just a scenario saying that perhaps when we do observational studies, and you find that one thing is linked to another, there might sometimes be hidden factors that you didn't find. And so there's no evidence that chocolate is in any way linked to MS, but that was just an example that, it might be chocolate, it might be zinc, it might be copper, anything like that.
Okay.
Yeah.
So any correlation between sugar or sweets and MS?
So not really. There isn't a direct, correlation there, but, there's definitely correlations between obesity and MS and, perhaps caloric intake, so it might be an indirect effect.
Great. With regard to the PUFAs that we discussed, any studies as far as finding a vegan diet or a vegetarian alternative to animal fatty acids?
Yeah, so, for example, that's one of the issues with a completely vegan diet is that then some of the omega-3 PUFAs are, cut out of your diet. But there are other omega-3 PUFAs in some of the vegetable oils, and so people can still get those. And so we don't know, however, whether actually that supplementation is necessary or not. So, for example, in that trial that I showed, which did not work, they were actually giving the omega-3 polyunsaturated fatty acids that are found in fish, and supplementing that didn't actually change MS disease activity. So perhaps it might not have any effect.
Great. We also got quite a few questions on probiotics, and if that was something you recommended, and how that's related to gut bacteria.
Yeah. So it's important to understand that our understanding of how gut bacteria are changed in MS is still evolving, and we have very few studies that have shown this so far, and what bacteria are changed and how much we still have only small numbers, and each of the studies tell us different things, and so it's way too early to say that a certain bacteria is good in MS or bad in MS, and it might be different in different people. And so at this point, I do not recommend probiotics to any of my patients because there really is no evidence that they are beneficial in MS. And we actually don't know that whether some of them may actually be harmful. So at this point, I don't think we have enough information to recommend probiotics.
Excellent. We also received a number of questions just how MS relates to other diseases, and this may not have been in your research, but specifically we received a question about diabetes and celiac disease.
Yeah.
Any correlation or a cause and effect that you're aware of?
Yeah, so we know that there are now 200 genes, and so variation in 200 genes has now been associated with MS. And if you look at the genetic basis of MS, there's a lot of overlap between the genes that are involved in MS and other autoimmune diseases. And one of the diseases that is very close to MS is celiac disease. So a lot of the genes that cause increased risk for MS also increase risk for celiac disease. And the same is true of diabetes, type 1 diabetes. So many of the genes that increase risk for MS also increase risk for type 1 diabetes. They also increase risk for inflammatory bowel disease. And so there are links between many of these autoimmune diseases. However, but that doesn't mean that just because you share genes doesn't mean that every person with MS is going to have celiac disease. It just means that there is a shared genetic risk, and so some people with MS might be at increased risk for getting those diseases.
And in those studies, were there different types of MS involved? Specifically, we have one writer asked, does primary progressive, does that fall in with the research that you've seen, or?
Yeah, so we know that basically, at least genetically, primary progressive MS is, the same genes are involved in primary progressive MS as in relapsing remitting MS. So So the genetic basis appears to be the same.
Great. Moving on, we have a few minutes left, and we did have a couple questions about the diet portion of the presentation, so I want to change the focus to that. The WAL protocol was really big for a long time. Is that something that you looked at or have any opinions on?
So, so the WAL protocol, I mean, it basically involves the paleo diet that has exercise and other stuff in it and supplements. And so, like I said, it really hasn't been studied in depth or, in a rigorous fashion. And the National MS Society just funded a study to actually study the WALS protocols in a large, in a proper fashion. And so hopefully, then we'll have more information on whether, how it actually affects MS disease activity.
Excellent. Any advice that you could offer? In a lot of the diets talks about restricting calories and certainly not eating too much. How to balance that with fatigue issues? If fatigue is an issue, how you can go about restricting those calories while also managing fatigue?
Yeah. So I mean that is it's a hard practical issue, and so just for example, there is one of the diets that's out there for fasting is called the Fast 5-2 diet, and so they basically are have a lot of tips on how to actually adhere to this kind of a fasting diet. And I can tell you that people who enrolled in our caloric restriction trial, a lot of them actually felt more energetic while doing the study with the fasting, especially after a few weeks of it. And so I think part of it is just be adjusting to them. And so I don't think it increased their fatigue by that much.
Great. One more diet-related question. We had a couple ask about your opinion on dairy and if there was a certain milk that you would recommend with these diets. Yeah.
So again, we don't really have that much, information about the effect of dairy on MS, and so I would think as such I don't recommend that my patients cut out dairy completely. I mean, some of these diets do require that. So, for example, if you're going on a vegan diet, obviously you have to cut out dairy. But it's also important to remember that dairy is an important source of calcium and vitamin D in our diet, and so those are important for bone health as well. And so, I recommend a moderate intake of dairy for my patients.
Excellent. We have time for one last question, and I think it's an interesting one. One of our writers, Lauren, wrote, "It seems like Europe and Canada and other nations are leading the way in studies on diets and MS. Where does the U.S. stand on its approach to studies such as these?"
Yes, I think the MS Society here is actually leading a big, effort to now study diet, and so they've funded 2 very large studies to study different diets in MS, and even the caloric restriction trial that's being done at Johns Hopkins is being funded by the National MS Society, and so there's a lot of efforts to better study diet, and then there's also a big push to also study the gut bacteria and the microbiome in MS, and so I think both of these initiatives will give us a lot more information in the next few years about what diets are beneficial and then what the diets are doing to gut bacteria as well in MS patients.
Well, it'll be very exciting to see where this research goes, and you're certainly on the cutting edge of finding out these answers. So we really appreciate all the work you're doing, and we appreciate Dr. Bhargava's time, as well as all of our listeners and our viewers, the hundreds and actually over 1,000 that viewed in. So If you didn't get your question answered, I want to let you know about some additional resources that are available from CanDo MS, namely the Ask the CanDo team. So you can send in a question to CanDo MS, and we will consult with our panel of experts from across the country to try to get you an answer. We also have a monthly newsletter program that you can sign up for, as well as an extensive library of articles. And there's a great article written by Dr. Bhargava that is on diet and MS that's available. So you can go to our website, which is www.mscando.org. In addition, as I mentioned, we partner with the National MS Society, who has a wealth of knowledge and some great resources and a whole section dedicated to diet and MS. And that website is nationalmssociety.org/diet. So please visit those resources as well. And as I mentioned, we do these webinars on the second Tuesday of every month. And we've done 15 in 2016. We're going to do 15 more in 2017. So hopefully you can join us again. Our next topic will be on sleep in MS and strategies to improve your sleeping habits and hopefully manage your fatigue. And that will be on Tuesday, December 13th. And you can register for that on www.mscando.org. So once again, thank you all for joining us on this election evening, and hopefully you can sit back and see the exciting results come in. And again, Dr. Bhargava, thank you so much for taking your time and sharing your expertise with us. I know I've learned a lot, and hopefully you have as well. So thank you again for joining us, and everyone have a wonderful evening.